Hello everyone, this is Dr. Clark from the Center for Weight Loss Success, and on this podcast of Doc Weight Loss, we're going to talk a little bit about some common myths of low-carb diets. Stay tuned, we'll be right back. Welcome back, everyone. And on this podcast, I'd like to talk a little bit about some of the common myths about low-carb diets. They're all out there. You hear these things all the time, really common myths, but there's actually a lot of myths about different diets. So there's many different diets out there, many misconceptions about diets, and this is especially true about low-carb diets. So let's look at a few of these misconceptions, what I've referred to as myths, and sort through what's real, what's not real. All right, so low-carb dieting, myth number one. It's mostly water and muscle. And really, the issue here is that, yeah, you may lose a lot of weight faster on low-carb diets, but it's mostly water and muscle, and it's not really about fat, right? Well, no, that's not right. Okay. Well, let's address that kind of the water and muscle part of all this thing. When we go on a low-carb diet, the low-carb diet, when your blood sugars are going to go down, your insulin levels are going to plummet. And when the insulin levels go down, you're going to be much less likely to retain water. And the reason actually is because now you won't retain sodium. And if you don't retain sodium, you don't retain water. And so subsequently, yes, you will initially get rid of a lot of excess water that you may have on board on your body. Okay? So yes, you will lose some water initially. So that part, yeah, it's true, but is that a big deal? No, because the water weight still shows up on the scale. Okay, the water itself isn't fat, but you're also losing fatty tissue as well. The second part is, well, you're losing a lot of muscle, right? Well, you want to, we talked about multiple times, is you want to preserve lean body mass. And that's very true in low-carb diets too. And the preservation of lean body mass, it will occur if you're getting in adequate protein and you're exercising. Now, adequate protein does not mean high protein. It means enough to preserve lean body mass. Now, typically that does, when we're in a calorie deprivation, like any diet, is that typically we do have to take in more protein than what we normally would take, but this does not necessarily mean high protein. So it's really a combination of the adequate protein as well as exercise. So yes, that's going to prevent that. It's not only water, and it's certainly not muscle, as long as you're getting the protein and exercising. All right, myth number two about low-carb diets is carbs are absolutely critical. The issue here is that many people say that we need carbohydrates for energy, especially when we exercise. Isn't that true? Well, not really. Okay, carbohydrates actually can block your body's ability to utilize fat as a fuel or the energy source. So if your body's used to taking carbohydrate all the time, it's going to want to use that carbohydrate as the energy source. But carbohydrate itself is not an essential dietary nutrient. We can do just fine without any carbohydrate from an energy standpoint, because we all have plenty of fat. We just have to have access to that fatty tissue to utilize it as the energy source. Now, under nutritional ketosis, which nutritional ketosis means that you're taking your carbohydrate down low enough that now we are using fatty tissue, which breaks down to ketones, as the energy source. Because our bodies can only use two different energy sources. Either glucose, comes from carbohydrate, or ketones. Ketones come from the breakdown of fat. Okay? So when ideally we'd like to be breaking down fat in a weight loss plan. So we want to use that as an energy source, but we don't do that effectively and efficiently until insulin levels have actually dropped. So the carbohydrate can block your utilization of fat. So, and even during exercise, a great resource from all of this really is there are a couple books out there that I really encourage people to get. Atkins' book is actually a good book, so I do encourage people. It's been rewritten a few times and actually is very good. But a very good book out there is also The Art of Low Carbohydrate Living. It's by Dr. Stephen Finney and Dr. Jeff Volek. Both of those are they specialize in low carb, and they do a lot of research and studying on this. And I would encourage you to look at that for more information. A lot of this discussion actually came from those books. There's actually another book, The Art and Science of Low Carbohydrate Performance, which is really looking at the athlete and actually can perform better on low carbohydrate diets, and you don't need to be carbohydrate loading beforehand. All right, so myth number 2, carbs are critical. No, they're not. Myth number 3 about low carbohydrate diets is there's a fear of fat out there. The issue here is that often my dietitian, my physician, agrees that, yeah, low carb diet's a great way to help you lose weight, but they're concerned about eating all this fat, especially the saturated fats. You don't want to be eating all this fat long term, right? Well, not necessarily. The fat has actually been falsely maligned for years and years and years as being the bad boy here. And fat really isn't the bad boy. If you are keto adapted, meaning that your body is utilizing fat as its energy source very nicely, not necessarily carbohydrates. So when you're keto adapted, fat actually becomes your body's favorite fuel. And so the dietary fat here is your friend. It's not your enemy. So the dietary fat is your friend under the low carb diet. Myth number 4 of low carb diets is there's that ketone confusion. The issue really here is that carbohydrate diets can't be good for you because as a side effect, the body will go into ketones. They make these ketones, right? Well, as I mentioned just previously, that isn't necessarily a bad thing. So ketones, again, are just an energy source. They're a source that comes from the breakdown of fat. So when carbohydrates restricted typically below 50 grams of carbohydrate per day, fat breakdown is increased significantly. And if we break down fat, you want to utilize that fat then as your energy source. So those breakdown of fat is ketones. So yes, ketones will go up a little bit in your bloodstream. So the level of ketones in your bloodstream is a little higher than someone who is on a high carbohydrate diet. But this isn't actually a bad thing. Your ketones will actually be utilized as the energy source. This is completely different from diabetic ketoacidosis. So diabetic ketoacidosis is where from blood sugars being so high that your ketone level is sky high. We're not talking about sky high ketones. We're talking about relatively low ketones, but they're just higher than what the normal person we have that typically eats a lot of carbohydrate. So this nutritional ketosis, where you have a good level of ketones, this nutritional ketosis is a completely different thing than diabetic ketoacidosis and is absolutely safe. So don't fear ketones, which is just a breakdown of fat, and it's an energy source for you. Myth number 5 from low carbohydrate diets, the saturated fat demon. Fat is that demon again. So the issue is maybe an appropriate fat diet is okay, but don't you have to avoid all those dangerous saturated fats? Now, when people are keto adapted, low carb diet, when they're keto adapted, actually it decreases the amount of saturated fat in your bloodstream. It's because you're actually going to be utilizing the saturated fat very nicely. And one of the best ways to actually increase your good cholesterol, the HDL, is that you eat a little bit more saturated fat. And there have actually now been 3 large studies lasting over an extended period, actually over 20 years, that actually revealed that there was no connection between saturated fat intake and heart attacks and death. So that was more of a theoretical concern. When we actually look at saturated fat, was it causing the heart attacks and death? It looks like no, it actually wasn't. So again, don't fear fat, and potentially if you're on a low carb diet, you don't have to fear saturated fat. Now, the issue there is you need to be on a low carbohydrate diet, because if you're on high carbohydrate diet and high fat, then one of your calories is going to be off the wall and your body will be storing fat like crazy. All right, myth number 6, feeling faint. The issue is I'm happy, I'm great with losing weight with this low carb diet, it's wonderful, but I get tired and I may get lightheaded if I'm exercising or if I stand up quickly. If I exercise for about 10 minutes, all of a sudden I'm feeling faint, I feel like I'm going to pass out. What's going on? This is bad, right? Well, you don't want that to happen, that is correct. But the issue is here, it isn't from the low carb diet. It's a low carb diet now that you're going to no longer be retaining salt. And so you're not retaining sodium anymore. You're basically excreting the sodium through your urine, through the sweat. If you're excreting all this sodium, you actually may need a little more salt. And so actually don't fear salt. So during keto adaptation, then, your kidneys switch from retaining salt to excreting salt as well as water. So you need to make sure to stay hydrated, but also don't fear a little bit of extra salt too. And this is especially true when you're exercising. Myth number 7, the short-term versus sustained weight loss. The issue here is that, boy, I'm ready to try this low-carb diet for weight loss, but once I've lost the weight, then my dietitian tells me, my physician tells me, my health professional tells me I need to switch back to a diet with lots of whole grains and other healthy carbohydrates. My answer to that is that a low-carb diet is actually a lifestyle. The fact that you've lost weight very nicely on a low-carb diet is actually proving your physiology, and very likely you're very sensitive to carbohydrates. And if you're sensitive to carbohydrates, if you switch back even to, quote, healthy carbohydrates of the whole grains and lots of fruit, both of which are very high carbohydrate amounts. So if you do that, basically your weight typically goes right back to normal because it'll bring your insulin levels back up. So low carb diet is a lifestyle. Carbohydrate sensitivity does not go away just because you lost weight. And if you lost any lean body mass during that weight loss, you may even be more sensitive to carbohydrates there. So you do need, one, you don't want to lose that lean body mass, but if you do, you may have to be even more careful with the carbohydrate there. So it can be sustained weight loss as long as you make this a lifestyle. Myth number 8. Moderation madness, meaning the issue here is restricting a whole macronutrient class seems a little excessive. This is extreme, especially carbohydrates. Carbohydrates give you quick energy, right? So we should be encouraging moderation, balance. I'm a big balance proponent. There's no doubt about that. Okay, but if there's something, the answer really here is if there was something, some essential nutrient that you were missing because we're on a low carbohydrate diet, then this would actually make sense. But there isn't. There isn't something that you're going to be missing because you're on a low carbohydrate diet. So there's no essential nutrient that you're missing, and so subsequently then things in moderation sound good, things in balance sound great, but if you're, again, very sensitive to carbohydrates, this doesn't work. It may not be fair, but it's the way it is. You're going to have to restrict those carbohydrates. And so, a good example of that is we kind of look at people that have like peanut allergies. Okay? Peanut allergies doesn't say, okay, they have to avoid peanuts, anything that had peanut in it. So it's not like you can have a moderation. It's like, well, you can just have one peanut. Don't have a bag. You'll be fine. It's like, no, if they're exposed to one peanut, they may be dying. So subsequently, we can't just get away from that. If you're really sensitive to carbohydrates, kind of all of a sudden then going back, I'm going to eat the healthy carbohydrates, that won't work either. All right, myth number 9, the missing micronutrient myth. The issue is here, can you get all your vitamins and minerals you need on a low carbohydrate diet? And the answer is yes, you can, because actually these are some of the healthiest food. Typically when I talk about people about the core of this low carbohydrate diet, hydration, water, we can't survive without it. Good protein sources, which from food, the best ones are meat, seafood, cheese, and egg, and then kind of fill in with the colorful vegetable salad stuff. sticking with that core, there isn't some nutrient you're going to be missing from there. So if you choose a good variety of this low carbohydrate foods, you will automatically achieve adequate amounts of all the essential vitamins and minerals. The eggs, the fish, the meats, the poultry, nuts, seeds, berries, cheese, olive and canola oil, cream, butter, a vast array of colorful vegetables. You're going to get everything you need. Sometimes people throw out this example of, gee, what about vitamin C? You got to get fruits and a lot of fruit for vitamin C. So actually, you can get it in peppers, cauliflower, kale, some berries. So you will get everything that you need there. There isn't, again, the missing micronutrients. Finally, kind of myth number 10 of the low carbohydrates. I'm going to get brittle bones and kidney problems. The issue here is I keep hearing all the time that diets like Atkins diets are low in carbohydrate. They're high in protein, and this is going to cause my bones to weaken, my kidneys to fail. Now, a couple things with that type of statement is, one, it's not a high protein diet. It's an adequate protein diet. We want adequate protein to preserve lean body mass. Generally, this is kind of somewhere between 90 and 120 grams of protein a day. And actually, multiple studies have looked at this, and they do confirm that bone density actually improves. Renal function, kidney function actually improves on low carbohydrate, adequate protein diets there. So in summary, there's actually lots of misconceptions out there, lots of misinformation out there about low carbohydrate diets. I would encourage you, investigate this yourself. Don't believe all the misinformation out there. Lots of different myths. I just touched the surface there. If you have questions, I encourage you, let us know. Go to our corporate website, which is www.cfwls.com, or if you want more access to me to ask questions, every single week I do a live webinar. To get on that, or just for that, go to our Losing Weight USA site, which is www.losingweightusa.com. You'll get access to me every single week, as well as tip sheets, menu, and recipes. Okay, lots of different information. I encourage you to investigate this further. Low-carb diet actually works very nicely for most people. Thank you for listening. If you have questions, again, don't hesitate to contact us. Remember, it's your life. Make it a healthy one. Take care, everyone.